Hello, everybody. This is Dr. Bob DiMaria with another episode of Ask Dr. Bob from Westlake, Ohio, and for Naples, Florida, and everybody from around the world. This is the first question. It's very detailed, but I want to answer it by saying the liver gallbladder mechanism is really important. Anytime that somebody has tender breast or heavy menses. I wrote a book on detoxification that I would encourage you to get, and also in Dr. Bob's Guide to Prevent Surgery, I have a chapter on liver gallbladder, because the liver and the gallbladder mechanism is so important. Your liver makes bile, the gallbladder is the reservoir of bile. You want that bile to be flowing freely. That's one of the reasons I encourage the ABCs, a half red apple every day, beets, beet fiber that is, a medium carrot, and also a radish. Those are really good digestive support foods for the liver. Dr. Bob, for those without gallbladders, how much ox bile to take at each meal? So here's a couple things. I would look at your blood test called the Opti-Chem Profile and check out your bilirubin to see if it's increased or not. That means your bile is not flowing freely. Because see, you have your gallbladder out and the liver makes the bile. A lot of your symptoms are going to depend on how your body reacts to fatty food. I usually have our patients take at least one of our bile products with each meal. If it's a fatty meal, you might want to do a little bit more. If you have gas 2 hours after you're eating, you probably need more than what you're taking. So it's going to depend on you. When I look at your own body, how big are you? What kind of food are you consuming on a regular basis? And you're going to have to adjust that accordingly. Dr. Bob, any help with bunions? You don't want surgery, you know? I will love to give you a simple answer. You're going to want to find a skilled physician to take care of that. And there are a lot of different types of physicians out there, whether it be podiatrist or orthopedic. I would ask around. Dr. Bob, what are the best essential oils to inhale for emphysema? I really don't know a whole lot about emphysema and essential oils, but I do know in my practice, we use a product called Organics 15 and a neonatal glandular product called Pneumozyme, which helps restore lung tissue integrity. But I'm not well versed in essential oils. Dr. Bob, could you expand more on how this injected heavy metal toxicity would affect your liver gallbladder? All healing, all detoxification has got to go through the liver gallbladder mechanism. So anytime you have any kind of heavy metal, I would also encourage you to possibly use some chlorella, because that's going to help get rid of those extra toxins in your body. When people come into our practice, we look at their films. We see if they have an enlarged liver or not. We look at liver enzymes. So chlorella is a product when you have radiation and heavy metal toxicity. You're going to want to eat sulfur-based foods like broccoli, cabbage, cauliflower, eggs, onion, and garlic. Dr. Bob, I am thinking about purchasing an elliptical stair climbing machine. You wanted to know my opinion. You know what? I just go find. We're building them in right now. It's 5 stories. If you were here, you walk up, you walk down. You walk up, you walk down. And probably try to find some other equipment that you would use, but you know what? You could walk and do stair climbing very cost effectively. Use the money you save to buy a good pair of shoes. Dr. Bob, I'm thinking, or I've been having this problem with my feet for years. It's itchy feet, and you've been to a lot of different doctors. You're unable to wear shoes, and you just have had this tingling in your foot, and it's full blown, and it's a real major problem. Now, I would start with an Opti-Chem Profile, if you were a patient of mine, and the Omega test, just to see what your fat levels are. The Opti-Chem Profile is going to tell me calcium and phosphorus. You may have a parasite issue, but we've had great success with itchy skin in our practice using black currant seed oil, adrenal support, and a combination of calcium, magnesium, and potassium. You may consider visiting me in either Naples, Florida, or Westlake, Ohio. Dr. Bob, how do you get your white blood cell count to increase? I would need to know more about what's going on in your body through an Opti-Chem. a CBC with a differential. What are you eating? Do you smoke cigarettes? How much exercise you're doing? Are you eating sugar? All of those impact what you do as far as a strategy. If you notice, it's not always about taking stuff. It's about what are you doing to you. So we don't promote sugar. Sugar will paralyze your immune system. My husband wants to know if there's anything else besides surgery for his knee. He had ACL, which is anterior cruciate surgery back in the 90s. I'd really love to help you, but I need to look at an MRI report. I would need to look at films of your spine, of your knee to make that decision. Dr. Bob, currently I take a B complex. Do I need B12 instead? Well, B vitamins all work together. So I would need to look at your CBC with a differential. That'll give you an idea if you need B12. An Opti-Chem Profile will tell me exactly what kind of B vitamins you need. So once again, a little bit more testing. Dr. Bob, how do you test and kill parasites and candida? Well, I want you to know this. It's not about killing. It's about changing you. Parasites and candida love sugar and fruit. I would focus on sulfur-based foods, eggs, onion, garlic, broccoli, cabbage, and cauliflower. We'll do a blood test called a CBC with a differential. We'll look at your eosinophil count. If your eosinophil count is elevated above 4, then we would address that accordingly. Great question, but there's a lot of possibilities for answers. Hello, sir. I got slammed playing basketball, and a kid fell on my knee, and it's been pain ever since. How can I fix it? Well, I don't really know anything about you. An MRI, films would be so important. I would need to take films of your body actually standing up to see what your alignment is like. So a lot of great questions. I apologize for some of the vague answers, but we need more to make a difference. And if you're not getting any help wherever you're at, we have people that come and spend a week with us in Westlake, Ohio, and Naples, Florida. I'm Dr. Bob DiMaria.